This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. Always a pleasure to have you with us. We invite you to stay tuned for the next hour. A lot of good information, courtesy of Dr. Molly FANTASIA, as you heard the man say, the PhD doctor, executive director, and founder of Innovative Medical Associates. And speaking of Innovative Medical Associates, we'll talk about what they do and how they do it and why they do it and how it can potentially help you and your family improve your overall quality of life. And that, of course, is important. So stick around here for the next hour. Health Watch, Talk Radio 1210 WPHT. Also, get out there and enjoy the day. It's a beautiful day.
It's going to be a great day, John.
Dr. Molly,
I got to get out for my walk.
Going to take your walk?
Absolutely.
Enjoy it because snow on Thursday. Did you hear that?
Yeah, I heard. And I heard a little bit of mixed weather, I guess, tomorrow.
Tomorrow, yeah. So
it's going to be crazy.
Listen, enjoy it today because we don't know when we'll see this again.
Amen.
In the meantime, if you have a question at any time during the course of the show, 855-839-1210 is our number. 855-839-1210. That's the number here in the studio. And we always like to start with Dr. Molly so people understand what you do. So explain to us, Innovative Medical Associates, the $64 million question. What do you do at Innovative Medical Associates?
Well, here's the thing. Innovative Medical Associates is a cooperative group of healthcare providers all working out of my facility in Marlton. And we are like any other primary care facility, similar to, I guess, what you would go into for an urgent care or absolutely your corner doctor if you had one again in the old days,
yes.
Right? You'd come in and your primary care doc, if you need a prescription, he can write it. If you need, some medication, we can do it. But the philosophy of our place is we'd like to use the least amount of medication necessary to correct the medical challenge and hope reduce the side effects of the medication, thereby helping you improve your quality of life by the use of hydration.
All right, so you do believe that you can use pharmaceuticals, and your docs have prescribed them, right?
Of course. Listen, you don't walk around with you got to use everything that's available to your black bag. That's the real philosophy of what we do. So if you need pharmaceuticals, we're going to give them to you. However, what we want to do is do them as judiciously as possible. I got the best medical people around. So we're able to look at this and say, how do we reduce the side effects of the medication that sometimes is worse than the problem itself?
I understand that because how many times did you read it? You read the disclaimer when you get the prescriptions?
It seems to me lately it's even more.
It's a book now.
That's
it's
right.
not just a pamphlet.
That's
it's
right.
a book.
That's right.
So the question, though, is always, does this, and you use pharmaceuticals, nutraceuticals, you use
right.
all of those things, but you use primarily in your hydration bag the nutraceuticals and
right.
food products,
right.
correct?
Right. They're natural
substances.
Well, John, I think what we want to say is not food products, but what we want to say is that we use a constituent that is around that was God's ingredients, okay? But it's the constituents within these certain products that really I'm looking to use. So, for example, when we use frankincense, everybody's like, this is the time of year. By the way, I have it in because this is the time of year I like to give it in the bag as
right.
a little present for Christmas. But the point is that it's really the bosonic acid that I'm looking for. There's a particular constituent in that actually effectuates the change and is anti-inflammatory.
You have had in the last couple of weeks, I made a joke the other day. I was there. I said, we're selling tickets because there was hardly any chairs left.
Yeah.
But you've had a lot of people with a lot of medical challenges.
Big ones, too.
Big ones that have really not gotten the results that they need or they want.
From conventional.
From conventional, yeah.
Right,
so
right.
you are getting a lot of people who listen to the show and
Absolutely.
come in and talk to you.
Absolutely. And again, I don't listen. One thing I don't do is hold people hostage, right, John? You come in for the free consult. I'm interested in your case. If we can't help you, we'll tell you. But I'm going to tell you, I'm going to try like heck to help you the best way we can.
You have over 600 protocols. So
yeah.
we say that because people are wondering, like you talk a lot about heart and cancer, but you have a lot of protocols for a variety of challenges.
It's interesting. This week, I have a potential to use my migraine protocol, and I haven't been able to use that in a long time. So I went back to refresh. I'm always learning. I went back to see what's new out there in migraines, and believe it or not, there isn't much out there. People are still using things like magnesium. But see, my feeling is you can't use a constituent. You have to use a group of those. And I also believe in using some medical devices with it. So it's going to be an interesting protocol. I have a pastor who came in who seems like a really nice guy, but he's been suffering for 20 years with these migraines. So I'm interested in working with him.
But chances are that you have a protocol for whatever the challenge may happen to be.
Sure.
Over 600 protocols and working on more as we speak, right?
Yes, I'm working on more.
All right, 855-839-1210 is our number here. Later on in the show, we'll talk about some new patients, and we'll talk about some other issues. I guess that the question is, and we're going to talk about this later on, but I've been hearing that more and more because of COVID, people are not able to get care or not able to get into a hospital for their typical challenges of cancer, heart, that kind of thing, which makes your situation probably more important because you're helping people as far as their immune system is concerned.
Correct. I mean, that's the way we should look at this. We should not have COVID be the thing that gives us the impetus to seek out keeping our own immune system and our own body healthy. That's really what's happened here. We have to be in a panic. Somehow it's human nature, right, John?
Yeah.
Human nature.
Yeah.
So unless there's a challenge, we don't want to do something. Bottom line is it's so much easier if we maintain our health. And part of doing that, from my perspective, is keeping the immune system in an optimal level. And the way to do that is with vitamin C, with B vitamins. There's so many nutraceuticals that can help people just in general.
But I guess the message is don't neglect it.
No,
don't neglect
absolutely not.
Your medical challenges.
No, you can't neglect your health, period. And that has been a big thing. And I think that's been one of the worries that I hear people talk about all the time. You know, they're concerned that they don't want to go into the hospital because of COVID. Well, tell you the truth, I don't blame them.
Right.
But at the same time, you can't let your cardiac care go. If you need to see your cardiologist, you better get there. And and then I encourage my patients to get right back in our chair, and that's really what we do.
When you're talking about, the immune system and all of that, and
sure.
The question always comes up. I know you had a couple of new consults this week, a couple of new patients, and I know they always ask the question, Dr. Molly, I've heard you all this time on the radio, and it sounds great, but for me, will it work? Does it work? That always comes up. I know.
Well, you know what I always say? I say the healing begins with the man upstairs. He's the big doctor in my mind. I know that I can give you the best that I have, and I can really work with you to tune up your immune system and move forward in your everyday life and improve your quality of life. That's my goal, and I know that we pretty much hit home runs doing that. Sure, there's some people that, sometimes I worry that some people come in and they're so hopeless. Listen, you know what I've decided? In my bags, the most wonderful thing I can ever do is give people a tincture of hope.
Yeah.
That's it. That's it. Because in the end, when you're hopeless, nothing works.
That's right. And so what happens is if you are hopeless and you get a couple of treatments.
And you start to feel a little better.
And some people say, well, I didn't get, and then they quit after 2 treatments because it wasn't a miracle cure.
No,
which you've always said it's not.
Listen,
it's not holy water.
It's not a holy water, but there is something to be said for the tinctures of hope and loving kindness that I believe really makes a difference in healthcare.
All right, we're coming up on our first break of the morning. Our show is Health Watch, Sundays 8 till 9. Here on Talk Radio 1210 WPHT, Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. Our number here in the studio, 855-839-1210, 855-839-1210. You got a question for Dr. Molly, or you have a medical challenge that you want to run by her, now's the time to do it. We always tell you to call early in the show because we don't want you to get shut out. in the last couple of weeks, people have been following our suggestion and just call early, 855-839-1210. After the break, we'll talk about some new patients. We'll also talk about a very good holiday gift courtesy of Dr. Molly and her good friend Dr. Harvey Glass. We'll talk about their skincare line and whatever you want to talk about it. 855-839-1210. We're coming back with more of today's version of Health Watch after these words. Back here on Health Watch, and as always, operators standing by at Innovative Medical while we're here on the radio, and they will be there well after we leave you at 9 this morning. The number is 856-489-0505. That's the number. Innovative Medical Associates, Marlton, New Jersey. 856-489-0505. If you call, you want more information, they'll be happy to get that for you. And also, you want to make an appointment to sit down with Dr. Molly, as a lot of people have done in the last couple of weeks. That's the number you call, 856-489-0505. Also, the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And we mentioned the skincare product, a great holiday gift that's developed by Dr. Molly and well-known area dermatologist Dr. Harvey Glass, who will be on the show in the new year.
I laugh. I told Harvey he's my senior consultant.
There you go. There you go. But that's a great holiday gift. Go on the website, innovativemedicalassociates.com, and there's a button there. You click it, and you can purchase the product. And, you got that situation now where I don't know what I got to get so-and-so. Well, perfect gift, all right? Innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. We got some calls waiting for us, so let's start with Frank in the Northeast. Frank, good morning. You're on with Dr. Molly.
Hi, Frank.
Hey, good morning, John. Dr. Molly. I called in because I want your listeners, regular ones, and if it's brand new, to hear what I'm saying. I saw Dr. Molly for the first time last week. I've been diagnosed for 20 years ago, last 2 years really bad, where I use a walker, I can barely get around, the tightness in my body from the muscle stuff. The first treatment, it happened while I was in the chair. It was amazing, everyone. I'm not BSing. I was expecting maybe a month later, maybe later than that, maybe 2 months. I believed she was going to work. It happened on my first visit. Dr. Molly, I didn't tell you this. That tightness in my whole body, I thought 100 pounds later, that's how heavy it was in my body. It was amazing. I mean, I'm still feeling the benefits now from last week.
You know what, Frank, though, is I like to tell you, it's not holy water, right? But it's going to take a little time for us to make sure that consistently happens to you. And I really want to tell you from my heart, I appreciate you taking the shot and letting me have the privilege of treating you, because you are an interesting case, my friend, and I want to help.
I know it's still a bad condition, but you made it so much better in one visit. I mean, one visit.
God bless you.
And everyone listening, Dr. Molly is capital H humble. I mean, she doesn't give herself credit. She's the best of the best. I've been seeing doctors for 20 years off and on. I told you last Wednesday, Dr. Molly, in 10, 15 minutes, looking at my lab work, she put it all together. She's the best of the best. I guarantee.
Oh, yeah.
Come in.
Oh, yeah. I hear you, Frank.
God bless you, Frankie.
I've experienced that myself, Frank.
Thanks.
So I know what you're talking about.
Frank,
both
you're
of you
the
have
best.
a great day. And
God bless you.
It's holiday time, people. Treat yourself. Come to Dr. Molly, or take your spouse or your Uncle Bob or Aunt Susie. Bring them in there. I mean it. You have a good day. I'll see you tomorrow,
Frank,
Dr. Molly.
God bless you. See you tomorrow,
continued
buddy.
success, Frank.
Bye-bye.
Thanks for the call.
I'm surprised.
Charlie is in the Northeast. Charlie, good morning. You're
Hi,
on with
Charlie.
Dr. Molly.
Hi, Charlie.
Hi, how you doing?
Good.
It's interesting I said that because I have neuropathy in my feet, tendonitis, bad circulation in my legs.
Any underlying
I was wondering about the sound wave therapy, if that would be good for the circulation of my legs. I am taking a leg and vein.
Yes. And a little bit, I would tell you, even a short course of some of the hydration therapy too, because what we can do is use the EDTA as well. That will help increase the blood flow down there. Plus, I have a couple of topicals that are really non-toxic to the liver. So, please, Charlie, come in for the free consult. I promise you.
I take a beef powder and stuff like that for the nitrous oxide.
I love that. Yeah, that's what you want to
fish
do.
oil, and I take this, that, and the other. I'm still
Sounds
walking
good.
No, I'm retired now.
Sounds
I had another
good.
question. I saw comorbidity chart.
Yes.
And it had the first people were high, were high blood pressure or heart.
Right. That's
and,
right.
Diabetes, blah, 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 blah. Went down the list. But way down at the bottom list, second from the last, my son's the one that showed me this, was HIV AIDS.
That's right.
Now,
That's right.
I can't believe that. Well, isn't that an immune problem, AIDS, and it's lower on the chart than high blood pressure?
Well, it is because of the population. In other words, there are not that as many AIDS patients. So if they start to crunch numbers, when you look at those charts, they're crunching the numbers. As I tell you all the time, right? You know, famous guy taught me. He said, "Figures lie and liars figure."
Yeah.
Don't ever forget it.
Right.
Okay,
Yeah.
He was the best.
Yeah.
All right.
I was
bless
just
you.
thinking that you'd be super
Yeah,
susceptible if you had an immune deficiency, and it's an
Amen.
immune deficiency disease.
Amen. Amen. You
Okay.
come in and see me. Oh, thank you.
Charlie,
thank you.
Charlie, thanks a
God bless
lot.
you.
Thanks a lot for the
That's
call.
a great
Appreciate
call,
it.
John.
Yeah.
Great call. Good.
Isn't that sound wave? Isn't that part of the men's
New
health?
men's health, yes.
Yeah, because
yes.
when you
acoustical wave,
when he
yes.
said it, and then you said yes, I'm
There
like,
is so much we can do with this new acoustical wave instrument. As I told you, I bought the Mercedes
yes, you told me,
the
yeah.
instrument because we can dial various wavelengths. We'll talk about that at a later show.
Okay, Mike is in Jenkintown. Mike, good morning. You're on with Dr. Molly.
Hi, Mike.
Hey, Dr. Molly, how are you?
Hey, good, Mike. How you feeling?
I have a question about it's my wife has got headache, but she got this hemorrhoid.
Okay, we're having a little trouble.
Any medicine? Can you recommend it some?
You said something about an MRI, Mike?
Did she have an MRI?
It's hemorrhage. That's blood vessel in the brain is swallowed 4 millimeters.
Oh, yes. You know what I would put her? Well, here's what she's seeing a neurologist, right? Good.
Yes.
Good. She wants to continue to see the neurologist. He's put her on something like Aricept or something? Anything like that?
Yeah.
Yes, good. What I would do is take something called vinpocetine. Hopefully that helps, and I would only use Life Extension. And I really don't like to plug particular brands, but in this case, because it is neurological, I like Life Extension because they do such research, and I can tell you, I pretty much love their statistical analysis. So hopefully that helps, Mike. And you should get her in to see me if you could, because I think I could improve that blood flow. Hopefully that answers your question.
As you have with many patients with blood flow issues. Mike, thank you for the call.
Thank you for the
and
call,
good luck
sir.
with that.
Thank you.
Rita is in Bucks County. Rita, good morning. You're on with Dr. Molly.
Hi, Rita.
Oh, she's gone?
She's
okay.
gone?
All right.
Okay.
Well, call us back, Rita, if you like, okay? All of a sudden, we got barraged with calls.
Yeah, that
855-839-1210. That's our number here, 855-839-1210. Again, our show is Health Watch Sundays 8 till 9 here on Talk Radio 1210, WPHT. You have a question for Dr. Molly, 855-839-1210. I know Frank called in. He was very happy.
Sure.
And I understand he was a big hit in the office.
Yeah, he was. The girls loved him.
What they told me. What is his issue? Is it pain or is it other things?
It's pain. It's muscle spasm. It's a combination. So, John, in looking and spending time with him and getting some history, and as well as looking at some of the data, it's a sort of a mixed bag. There's no one single thing that they're looking at. They're not saying it's MS. They're not saying it's Lou Gehrig's disease. They're not saying, but he definitely has a neuroendocrine problem that is also giving him an issue with his muscles and how he can walk and these kinds of issues. So when we looked at that, I look at it like as a subset possibly of MS, those kinds of things. So what you try to do is you try to utilize the therapeutic options that I have to help improve his quality. Can't cure the problem because I don't even know what it is. That's the truth. That he's saying Dr. Molly's humble. Dr. Molly must be dumb. I don't know what the problem is, and neither does his doctors. I think only the man upstairs knows what the real issue is, but it is a combination of autoimmune in some regard, really.
Well, you must have done something because he said he felt better.
Exactly.
So obviously you...
What I did was I tweaked what I consider the MS therapies and the Lou Gehrig's therapies. I sort of joined those together and then looked at inflammation as in systemic inflammation, which of course I did see. And here we go. I have him on a protocol to help in that regard. But again, he did so well because he was so bad when he walked in.
Yeah, he was bad because he's called here many times.
I know, he's a nice man.
And you've said to him, come in and
Let's
perhaps
see what
I can
we
help
can do.
you. Right.
Let's
so,
see what we can
so
do, and that's
obviously,
what I'm doing.
Right. Whatever you did.
He's a great guy.
Yeah, whatever
nice
you
guy.
did. But that seems to be a common theme.
Inflammation,
at your
inflammation,
facility.
inflammation.
Yeah.
Everywhere. And there are so many causes of inflammation, and there's so many different types of inflammation. And I'm afraid that, again, we're back to what is it? What goes haywire in our own autoimmune system, and what goes wrong that starts the autoimmune system to go out of whack? There's the question. Is it external? Did you have a fall? Did something start the body down the road of over inflammation?
And so in the course of treatment now, he's coming back in.
Yes.
Right? And
yes.
you figure, 10, 15 treatments,
sure.
maybe more?
And he's going to end up, as I told him, I said, I hate to say it, you're going to go steady with me at some point. Maybe not every week, but he's in for, he's had this for a long time. So he's going to be going steady with me, similarly to many of my patients. Once they get through the acute phase, by that I mean the acute phase of their quality of life issues, they want to maintain it.
Yeah. Look at me, 20 years.
Amen.
And for those,
I want to keep you for another 120
well,
years.
sure. For those who say, "Do I ever get better?" I'm really okay. It's
That's
just
right.
This is maintenance. What you're doing.
Exactly.
Right.
Exactly.
So, all right, we're coming up on a break. It is Health Watch. Every Sunday we're here from 8 till 9 on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Again, we have some open lines, so if you want to call back in, there's no waiting. 855-839-1210. 855-839-1210 is our number here in the studio. With Dr. Molly Fantasia, again, I'm John DeMasi. Coming back, more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates. If you would like to talk to them, you want to make an appointment to sit down with Dr. Molly, as you've heard a lot of people have done recently, 856-489-0505 is the number. It's Innovative Medical Associates, Marlton, New Jersey, 856-489-0505. You have a question, you want to make an appointment to sit down with Dr. Molly, that's what you do. You call them right now, and they'll be there well after we leave you at 9 o'clock. And if you want to wait till during the week, you can do that as well. That's the same number, 856-489-0505. The website is innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you're still at a blank as to what you're going to get so-and-so on your list, well, we suggest skincare, courtesy of Innovative Medical Associates, developed by Dr. Molly and Dr. Harvey Glass, a well-known area dermatologist. So it's a great gift. And really, it's something they can use, and they can use for a while. So pretty simple, all right? You can do that as well. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Back to the phones. Mike is in Williamstown. Mike, good morning. You're on Health Watch with Dr. Molly.
Hi. Thank
Hi,
you.
Mike. Yes.
Hi, Molly. Dr. Molly. I was going to call you guys later on, but when I heard Frank and his symptoms, I just had to call in.
Good.
I have what familiar is called polymyalgia rheumatica.
Yes. I'm familiar with
it.
So, yes.
Yeah, I mean, most doctors seem to be, but it's not like something that's on everybody's CPT code.
Exactly.
And so I have been poked and
right.
prodded more times than if I've been abducted by aliens.
No,
and they
but
still don't know what's wrong with me.
Do you know what? I'm really glad you called in. This sort of, I'm sorry that you're having the problem, but I'm very happy you called in because it's one of the things I thought about. Here's the thing about it, right? It's an autoimmune disorder. They don't really have a CPT code for it. You're right. It mimics, as I was saying earlier, it can mimic things like MS or Lou Gehrig's because you have the weightiness in your legs and the spasms, all those things, and the pain.
Yes.
The pain.
The pain is terrible.
Yes.
I wake up at level 7 every morning.
Oh, my God.
Until
How
I
old
take
are you?
acetaminophen and ibuprofen and gabapentin.
Oh,
600 milligrams 300 times a day.
John.
Oh, my, wow. Remember that?
Oh, yes.
Oh,
Listen,
boy.
So how old are you, may I ask, sir? How old are you?
Sure. 62.
You're a baby.
Oh, Jesus.
Oh my gosh.
Yeah.
And can you think back in time when that occurred? Did you have a stressor in your life?
Sure.
Yeah.
Yes, it was.
Okay.
I just got done working a very stressful job,
Okay.
and I quit. And I was working some other jobs, and then the next thing you know, I bled out. It was kind of a hemorrhoid thing, but
Right.
I didn't realize, and I bled out. I was in the hospital then for 3.5 weeks.
Oh my God.
And by the time I got out, I felt like I just got out of, some kind of. I couldn't walk. I couldn't walk. I almost needed a 4-point walker.
Oh my God.
So that was 2 years ago, and since then it's been highway to hell.
Oh,
Listen, please come in and see me. Please. Look, I can't cure this condition, but I certainly can help you improve your quality of life. I know we can. And I love Frank for his call. But again, I don't want you to think that, you get this, it's like holy water. It isn't. It works in tandem with some other things. Oh, yes, I would love to talk with you. No pressure, but I think you'd be surprised at some of the nutraceuticals and things that I have that can help improve your quality of life and get that pain at least a little bit lessened than a 7, I'm pretty sure.
Yeah.
And also improve maybe the muscles. I mean, this is terrible. It's a terrible condition. And I really applaud you for bringing it out and letting people know that it's by the way, it's a real condition. And I hate when physicians tell me, a lot of that is
in their head.
Is in their heads.
Right, yeah.
They're right. It's a neuroendocrine dysregulation.
Right.
It is in your head.
Yeah.
Do you know what I mean? But it's not the way they're telling you.
Right. The pain is real, basically.
Pain
is
is
what
real.
Right.
That's right.
Yeah, I'm
God
seeing
bless
5
you.
different doctors. They all nod. As soon as I say polymyalgia, they're all like, oh, yeah.
Yeah.
But
Yep.
No, it's just the same old thing. It's really been hardly any benefit for the last 2 years.
Give us a shot.
Yeah,
come
Mike,
on and see me.
Mike,
Just
good
come in
luck
and
with
see
that,
us.
and
God
keep us
bless
posted,
you, Mike.
okay?
God bless you, Mike.
Thanks a lot for the call.
Great
Appreciate
call and a great thing he said, because it's very similar to what I'm saying. This kind of condition, I think, can be improved with a subclinical dose of something. As well, that gabapentin, all of those. Listen, they have a place. Now, don't I don't want all the neurologists out there to start killing me. I believe in medication. But if we can reduce the amount that this poor guy is on, we're going to improve his quality of life.
And he's in serious pain.
Absolutely.
When he said 600 milligrams.
Yeah.
I remember we talked about this. I have a back problem, which you've been treating me for. It's still not 100%.
No,
but
I know that.
But I remember I went to this orthopedic specialist at one of the famous institutions in Philadelphia. And she prescribed this medicine, and I said to myself, I know what Dr. Molly's going to tell me. I've been working with you for over 20 years, so I know what. And you said to me, you take that. You're going to be in La La Land. So can you imagine Mike's pain?
Doctor? How about my doctor when he saw it? Oh, my God. It was like...
Yeah, Dr. Pat saw it. She said, oh, my God, what are they doing to you?
Yeah, what are they doing, right?
So I never took it. But,
No,
I mean,
that was
when
right.
Mike said that, I'm thinking, boy, he must be in pain.
Yeah, he is, and I'm sure. I would really like to see him, and I know about this condition, and again, it's sort of nebulous. It's not something that a lot of docs say, that's what you have, because again, he said it right out. It doesn't have a CPT code. He's right.
Right, exactly. Okay. 855-839-1210 is our number here. 855-839-1210. Again, it's Health Watch every Sunday, 8 till 9, Talk Radio 1210. WPHT. I know you wanted to talk about this these new patients. It's a husband and wife.
A wonderful husband and wife team.
And this just happened the other day. And talk
they
about
just
it.
came in. They came in about a week ago, and because they traveled so far, they were way out in Chester County, almost into Maryland's border. I actually did something I don't usually do, which is I gave them the scripts. I had the medical director sign off on the scripts for blood work. And I sent that to them to get the blood work so we could prepare for them to come back after the free consult. When I heard their story, they're beautiful people. They're both self-employed. They're highly intelligent folks. They work hard, work very long hours. You can imagine. Husband has a business. Wife has a business. So they're astute. They both have certain conditions that overlap, like hormonal dysregulation, because they're not kids.
Right.
And what they want to do is improve the quality of their relationship as well as improve their quality of life. Well, I think they came to the right place.
Right.
Because we are going to work like heck to make sure we help improve the quality of their relationship, because I'm all around. I believe the gentleman is going to start our men's health program in January when I have it fully functional. But in the interim period, having listened to some of his challenges with pain, etc., we started him on some of the hydration therapies on Friday. And also in terms of the wife, I see that there's a huge hormonal component to what she's going through when looking at the blood work. And it's interesting from my perspective because they had consulted other physicians and they've listened to other clinics who do similar work, allegedly, like we do. I say allegedly. Because, I'm not a big proponent. If we can gather the information that we use by using your health insurance for the lab work and that kind of stuff, we try to do that, especially if we know that it's appropriate testing for you. So again, in conversation with the medical director, etc., we sent out her lab work, and I see that she has big problems with perimenopause, etc. She started her IVs to help the nutritional aspect, and ultimately I think we're going to work with her to improve the hormonal balance, reduce pain for both of them, and get them back in the pink.
And what is the schedule? Is it going to be 10, 20, 15?
Once a week, and okay. I think we're going to dip our toe in, start with the 10 treatments, probably more likely going to be 20, at least for the gentleman. And I think then we'll see where we are. We're going to get some more. Obviously, I have the baselines. While they're in the chair, I'm going to grab some more blood so that we can continue to monitor them. And then they're going to come in as needed after that to maintain a reserve.
There seems to be kind of a common theme this morning to the show, and it's kind of a common theme all the time, and where you have people coming in that have been everywhere.
Frustration is the common theme.
No results or minimal results, or somebody doesn't know what they've got. So I'm just curious as to, it seems to be, like I said, a recurring theme. How does it happen so often?
Well, I think here's the big challenge, John. The people who listen to this station are thinking people.
Yes.
Right?
Yes.
So they don't just sit around and say, oh my gosh, Dr. So-and-so told me I have this. Again, I'm going to say I love our conventional physicians. I have two. Okay? I have two. But the bottom line is this. They don't just take it in and say, well, it's in your head. You need an antidepressant. You need an anti-anxiety. Sure, when you need an anti-anxiety, you better have it because anxiety causes all kinds of physical problems, right? Sure. But not everything is in your head. Not everything is something that can be cured with a pill. If we don't straighten out the underlying issues, if we can't tune up your own immune system, if we don't give your body the proper functional nutrition for you to continue to have a healthy life for where you are in your continuum of life. Listen, how we are, you and I, how we are at 70 is not the same as when we were 50.
Wow,
okay?
I believe that.
Okay?
Yeah.
But it doesn't mean we have to go into, assisted living either. It doesn't appear like you and I need assisted living, right? There are some people who do because they've had a myriad of problems all along and they didn't take care of them. So the bottom line is this. You've got to meet patients where they are. Listen to the story because the story is always the thing that helps give you the clues as to where we have to go with them in terms of improving quality of life.
Yeah, but it just seems like, I guess it's just because of the callers today, but it seems like we always talk about this, and you've heard people say, well, I went to this doctor, and he was like, yeah, okay,
Listen, how are you going to equate? First of all, most physicians don't have the time to spend with you that we do in our clinic.
Yes.
Right?
Yes.
Right there and then. Now, that comes with certain constraints on both sides. I mean, my people make a commitment to come in once a week or once every other week
or twice a
whatever,
week.
or twice a week, my people make that commitment. And, I'm a big believer that time is money also.
Yes.
And I know that, and I respect people's time. I respect where they are. So bottom line is, you also don't sit around in my clinic and wait to get into the chair for 5 hours.
No.
It doesn't work like that.
No.
Okay? No. So we really try to be cognizant of what we're doing there.
All right, coming up on our final break of the morning, you still have time to call in if you have a question or a thought for Dr. Molly. 855-839-1210 is our number here, 855-839-1210. Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More Health Watch after these words. Welcome back to Health Watch. As always, operators standing by, and as we come towards the end of the show, they will still be there after we leave you at 9 o'clock while you continue to listen to Talk Radio 1210, WPHT. The operators will still be there, and you can call them at 856-489-0505, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey, 855-839-1210. Yes, thank you, Dr. Molly, for reminding me. I was about to say that anyway. The Health Watch replay, now, for the next couple of weeks, until the end of the year, the Health Watch replay is going to be on at 6 a.m. on Sunday morning. So you're going to hear today's show next Sunday at 6 a.m., 6 to 7. And after the new year, because of NFL football, we're carrying NFL football. So,
right. And thank you. I'm glad we are.
Yeah. But anyway, come the new year, we'll be back to our Health Watch replay time. So, but right now, 6 to 7 a.m. every Sunday, Health Watch replay here on Talk Radio 1210 WPHT. Couple of minutes left of the show. You still have time to call in if you have a question for Dr. Molly at 855-839-1210, 855-839-1210. We always like to talk about some of the patients, Dr. Molly, and you truly have an amazing patient.
I do.
In Mary. And Mary and I always, when I'm there and she's there, we discuss politics.
Yeah,
yes,
I know.
yes.
I know. Gets the house going.
Exactly
right.
right.
Great.
And
it's great.
Yeah. But anyway, talk about Mary and her
Mary's
condition.
been with me for over a year. Mary has a very bad woman's cancer, and I mean stage 4 when she came to me, which is over a year ago, maybe close to 2 years now. And of course, I got in touch right away with my consulting oncologist. She and I went up there, and we had a consult with the oncologist, put some program together, and she's being followed up by us and my medical team here in Marlton. And I had she's also doing conventional. She's doing some conventional treatment. It's just done a little differently from this oncologist and doing very well. And interestingly enough, I had a meeting with him, as I often do every couple of weeks, about her case. And he said, his words were, "Dr. Molly, she's doing remarkably well. I think you had a lot to do with it." I said, "No, I believe you did, doctor." And he said, "It's okay. We can have a mutual admiration society." But he said, her functionality is where I'm going with this.
Yeah.
And again, it just helped reiterate what I talk about. Like, you've got to get through certain treatments, so you need to be in tip-top shape. We have to optimize your health so that some of the treatments that are rough, you can get through fairly easily. That's the point of the story.
And I must say, I've had many conversations with Mary. When you told me what her age was,
yeah, she's in her. We have to say 80 blankety blank because she won't like it. If we say
I said, "You're kidding me."
Nah,
said,
she
"No."
looks great. And notice, through her traditional treatment, she didn't lose her hair. That's because we have a little secret.
Yeah. Okay. Well, certainly contact you for the initial consultation.
Right
and
on.
you'll pass that along. All right. We have a caller. Jim, did you say Yolana?
Alana.
Okay. Yolana in Philadelphia. Yolana, good morning.
Hi.
Welcome to Health Watch.
Yeah,
You're on with Dr.
how
Molly.
Are you?
I'm good.
Hi, how are you? Can you hear me?
Yes, ma'am.
Loud and clear.
Okay, I have a question. Maybe it's a little different than from what everybody else is calling. Do you do anything for people who have asthma?
Oh, sure. Absolutely. Asthma, and asthma can be pretty debilitating, right? Are you on right now? Are you on asthma medications right now?
Yeah, I take Ventolin, and I just finished 2 courses of the Medrol dose pack.
And
it's been acting up really bad. I have an appointment this Thursday to see my primary care physician, and I was wondering.
You have an allergist, right? Do you have an allergist as well, and a lung guy? You have a pulmonary guy too, I hope.
I went, but I didn't like them very much. They,
I love you. Okay, I understand.
We've never heard that.
They were going to start doing some kind of treatments, and that didn't go along very well with me. I'd never heard of anything like what they said. But I did go to an allergist one time, and they basically did the allergy test, and I'm allergic to everything except feathers.
I believe it.
I'm literally allergic to everything.
I understand.
And I do have pets, and I have no intention of getting rid of them.
Well, I don't want you to. They're your buddies. I have a pet too, right? I wouldn't want to get rid of her. So, listen, one thing I want to say. How much vitamin C do you take a day?
I don't take any.
Listen, Anna, come in and see me, will you? Just come in for the consultation. Okay, I think you'll leave with some information. And if you're open enough to think about taking some hydration along with certain other things, tinctures I'd like to put you on, I think you're going to be a different woman in a year from now. Just listen to me. Yes, asthma is a debilitating condition. It can be. People poo-poo it. It is not something to poo-poo. Your lungs, actually, he has you on the dose pack, I suspect, because you were so bad either with the coughing and were you running any kind of temperature or anything, Lana, or just overall the coughing, et cetera?
Just wheezing. And just
Yep.
breathing.
Now, and you understand what the steroids do. They shut your immune system down so that hopefully...
they're very bad. Very bad for you.
Right. Well, then you hope that the body then resets. And I think I can help you do that post this thing. So please come in and see us. It's a great question. How old are you, honey? Just a quick question. How old are you? Baby.
66.
Baby, you're a baby. Come in and see us.
A lot of babies this morning.
I had a lot of babies. Do not give up, and I don't want you to feel hopeless. There is hope for this condition. Please come in and see us. Thank you, dear.
Good luck with that, Yolanda.
Great questions today.
Yeah, and you can certainly call right now. Operators are standing by. It's like today's theme is like I'm at my wit's end. It's hopeless and blah blah blah.
It's never hopeless,
right? Well, that's good, but I mean, you can understand
frustration.
Exactly.
What's everybody's going through is they're going through frustration illness. That's the bottom line.
Yeah.
And what we need to do is open up our minds, open up our hearts when we treat these people, and know that there is a way to improve their quality of life. We may not be able to cancel out their condition, but I'll tell you, they're going to be more than 80% better.
That has to be really frustration. The wheezing and all that stuff. That's got to be.
Of course.
And
it's autoimmune all the way. It's autoimmune all the way. There's an outside trigger that starts it. I'm a big believer in environmental medicine. So yes.
Okay. Again, it's Health Watch every Sunday, 8 till 9. Talk Radio 1210 WPHT. We should remind you as we come towards the end of the show that our replay, you can hear it now 6 a.m. till 7 a.m. Sunday. So you get last week's show at 6 o'clock, and then you can listen to us at 8 o'clock, the live version. But this morning, and back to what we started by talking about COVID, and the tendency is now, I don't want to do anything because of COVID.
Wrong.
Well, I mean, how long can you hold off?
You can't. And, everybody's all hipped up because all the inoculations are out. I think COVID's going to get under control. We're going to move ahead. But in the meantime, you've got to take care of your own immune system. You know what? The government isn't in charge of that. You're in charge of your own health, John. I say that. Take an active role. Yeah,
we should tell the audience when you asked Yolanda how much vitamin C. Remember, I put up I put up 0.
Yes,
and then she said none. Because I just had a feeling,
Right, and that's a bad thing. And that's because, look, let's face it. You can't expect your traditional physicians to recommend nutraceuticals because all the time they're worried about side side effects. Well, guess what? You and I both know I put nutraceuticals together for the synergies of what they can do to effectuate the change and help your quality of life. But you got to know how to do it.
Right. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical at 856-489-0505, 856-489-0505. You can call them well after 9 o'clock. They'll be there, or you can call during the week. That's the same number. And check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, listen, you're coming down to the wire on holiday shopping. So if you want to get a nice gift for someone, check out the website, and there's a button there for the skincare line. You can check that out, and as I said, it makes a great holiday gift for someone. For everyone at Innovative Medical Associates, Dr. Molly Fantasia, of course, and our staff, the lovely Linda, and we have fabulous Fran, Barbara, delightful Dee, Joanne, and our nurses Jess and Crystal, and our medical assistant Kathy. I'm your host, John DeMasi. Always a pleasure. Thanks for listening. Have a great week and a healthy one. And we'll do it all over again next Sunday, the live version, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.